Aloha again. Thank you for joining us. We are going to continue our conversation about the Rural Residency Program from a little bit of a different perspective. We have guests with us now to explain the community-based effort to get this program going. Again, I'm joined by Senator Takamine, and also we are joined by Lori Rogers, who is the Executive Director for the Hilo Medical Center Foundation. Also joining us is June Kunimoto, who is a trustee for the Hilo Medical Center Foundation and former district health officer for the Department of Health on the Big Island. And we're very pleased to have with us today Bob Lindsey, who is the Office of Hawaiian Affairs trustee from the Big Island. And so we wanted to begin this conversation really by pointing out the strong support that this program is receiving from the community. And Dwight, maybe you can help explain that part.
And I think, we heard earlier how the Big Island generally has a reputation of pulling together, whenever there's a special need. And I think the foundation, has played a critical role in trying to address the current circumstances facing the community, the Big Island community. And Laurie, I thought maybe if you could help introduce the foundation and maybe some of the aspects before we really get into some of the details of what you're actually doing, to help all of the people.
Okay, thank you. The Hilo Medical Center Foundation is a nonprofit entity, and what our mission statement, what we're about is we're there to serve the community and the hospital on healthcare issues. The foundation is ran by a board of 29 individuals from the Big Island, wonderful, committed people who all volunteer their time. And the foundation has been responsible for two very large projects there on the Big Island. We're there for the community. So what we did with the foundation renovated the emergency department. So the Hilo Medical Center Hospital has a nice new emergency department. The community wanted it. It got remodeled. It was work involved, but it got remodeled. And then the foundation was also responsible, of course, from the community aspect for the State Veterans Home.
The residency program, to be fully implemented in a meaningful way, funding is at the heart of that, is part of that, but part of the challenge. And you just noted the effort, the success that was created on the Big Island with respect to the emergency room, funding, and that you had the community play a substantial role, working hand in hand with the government to provide the necessary resources to make that happen. And now it's serving the needs of the broader community. And June, I know you played a critical role in that. And could you touch upon that and what you see as bringing the success that occurred there?
I think the Big Island is very, very unique in people working well together. Whenever there's a situation that needs to be addressed, it seems like agencies and individuals come together for a common good. And the example of the emergency department at Hilo Medical Center was a prime example. What the hospital did is they did a focus group in the community and said, what is the most critical area that we need to look at? And unanimously, they said the emergency room is a horrible situation. The wait time, there were a whole bunch of people who just gave testimony on how bad it was. Based on that focus group meetings that we've had, the foundation took it as a first priority for the foundation to see what we could do to renovate the emergency department so that it becomes the first entree into the medical center and people feel good about the hospital. And together with the legislators and with the community, we were able to gather the community, and everybody knows that East Hawaii is a very poor community. We have the highest rate of people who are below the poverty line in income. And that community was able to raise over $1 million. We needed to do that in order to get funds for the governor to release the funds that the legislators had already appropriated so that we could begin our renovation. And we're happy to say that today, earlier part of this year, we had our open house, and we have nothing but really positive feedback from the community itself. They're no longer waiting out in the rain, because the waiting room is too small. They have a very comfortable place that they can sit in We have enough emergency room beds, and I must compliment not only the community, the legislators, and the governor, but also the staff at Hilo Medical Center to have withstood the years of going through that renovation. And I think that shows a kind of commitment and working together with all entities to get this going. And it's the same thing with the VA home. It wasn't as big a project, but with the help of the community and with the foundation, we were able to get that going together with Senator Inoue.
Right.
You know, that is such a key component. And for the first time in the state of Hawaii, we have a VA home located, luckily, in Hilo, Hawaii. But I think that really shows the kind of commitment that the people have on our island in making sure that we all work together for a common good. And I think that is such a big blessing that we have on our island.
Yes, you feel that on the Big Island for sure.
I just wanted to take off from some of the remarks that June just made about folks on our island working together, working well together, working together for the common good. And as OHA's representative here, I hope in time that we'll be able to link up the folks from our Native Hawaiian health systems with all of you and somehow participate in all of the good work that you're doing for the people of our island. I'm talking in particular about Papaola Lokahi, who is the umbrella organization for Hawaiian health here in the state of Hawaii, but in particular Michelle Tuber and the folks at Hui Malama in Hilo, who service folks all across our island.
You know, I think that actually that Hui Malama office is located in the same building where the rural residency campus, quote unquote.
Oh, okay,
is
right
gonna be
there on
located. So-
Railroad Avenue?
Right.
No,
Yes.
it's right there.
The Maho'oli building.
Yeah.
The
Oh,
Malama
okay.
Medical
Yes.
area. They're right in that same building.
Oh, okay.
Urgent
So it'd be,
care.
it'd be a real
Oh,
good,
yes.
close working
Yeah.
relationship.
We're neighbors already,
Right.
so
Very good.
Yeah.
the table set.
Yes.
No, I think you're right. You know, the partnerships that we can establish to bring these projects to realization, I think is so key. And I know that the rural residency program now is a tremendous focus for the foundation. So can you help us understand, you know, what's going on? And
Sure.
Okay.
The foundation, we wrapped up the renovation of the emergency department. At our January board meeting, the board discussed what are we going to support and really grab onto now. And the residency program, it's there. So the complete board voted, this is what we're putting all of our efforts to, this residency program. As Josh Green stated, the monies weren't released. Prior to that, the foundation started a petition out in the community to try to get our voice heard. Please release those funds. It's very important, release the funds. In 8 weeks, we gathered over 6,000 signatures and heard one story after the other story from people who live on the Big Island, and they're not good stories, who have issues not finding a doctor. I can't get this, I can't get that. I have to go to the emergency room to see a doctor. So we gathered the signatures. The money wasn't released. We had our board meeting. The foundation decided we're still going to stick with this. We need this for the Big Island. We can't let this die, because good economic times or bad economic times, health care doesn't go away. We all need good health care. So we're out fundraising, and we're trying to collaborate with other groups, get support, and as you said, on the Big Island, we all come together for this. And to date, out in the community, and this is people, as you said, June, who don't have a lot of money. They're writing checks to support this. We have $18,700. Not a lot, but we're going to get there.